Hello again. Now, the country is preparing for a fourth COVID-19 wave as we are marking World AIDS Day today. The theme this year is End Inequalities and AIDS. The global response to AIDS has been a success story with deaths cut in half over the past 2 decades. But here in South Africa, we have the world's largest antiretroviral program. But have we won the battle against the virus? And what lessons can we apply on how we've been responding to COVID-19? And how has this latest pandemic impacted or affected programs to continue fighting against HIV/AIDS? Well, to discuss this, I'm joined now by human rights and social justice activist Mark Heywood, epidemiologist Dr. Jody Boffa, and Ian Sanne, CEO from Right to Care. Thank you very much for joining us here on eNCA this afternoon. First up, I'm going to ask each of you a quick question, overriding one, and then just give me a brief answer, if you may, with the time that we have allocated here. I'm hoping to cover a bit of ground. How has COVID-19 affected the fight against HIV/AIDS? A pandemic that's been with us for 40 years currently. Can I start with you, Mark?
Good afternoon, Dan, and fellow panelists. I think that COVID-19 has caused us to take our eyes off the ball of HIV and tuberculosis. For understandable reasons, COVID has been an absolute priority. It has taken its toll on the health services and on life. But HIV didn't go away during this period of time. And we have anecdotal evidence, and I think we will have much better data as in the months ahead, that it has led to certain setbacks in the numbers of people who are testing for HIV, the numbers of people going on to tuberculosis treatment, and quite possibly certain reversals in the gains that we had made around access to antiretroviral treatment. It's by no means a disaster, but it is certainly something that we should be very concerned about and that we should seek to rectify as a matter of urgency.
And for you, Dr. Boffa, what stands out about the way the pandemic has affected the fight against HIV/AIDS?
Well, I think it's prevented people from accessing clinics out of fear. In the early days, it prevented people from accessing it just because of number restrictions for people entering clinics. But it's had some, there's been some fairly good gains as well, such as people who are doing well on treatment being able to access multiple months of treatment at a given time. So maybe a little more convenience for some people who don't have to keep coming into clinics unnecessarily. But it's been a rough time in the HIV and TB worlds.
Yeah, it's been a rough time. Prof. Sanne, would you agree?
Yes, I agree with my fellow panelists. I'll give you a couple of data points that we have been monitoring actively. So in terms of maintaining patients on treatment, we have dropped off our, despite very hard work from the Right to Care team, we have seen around 10 to 15%, depending on which province and which country, we've seen a decline in follow-up of patients. We're making every effort to bring them back into care. The second is that we've seen, because of COVID and because every coughing patient first is considered to have COVID, we have seen a drop in 75% in terms of samples submitted for TB diagnoses. That's a very significant number, whereas South Africa was making gains in reducing the incidence of tuberculosis across our population. We are very concerned that it's almost 18 months to 2 years now that we have underdiagnosed TB.
So one of the aspects that has sort of been prominent today, it's with this Omicron variant with COVID-19 and how it's affecting children. I was speaking to a general practitioner a little bit earlier who was saying in his practice he's seeing more children now who are testing positive for the pandemic. But we know that, and coming to HIV/AIDS, according to the United Nations, we've seen a child being infected with HIV every 2 minutes, and that the bulk of children, particularly on our continent, don't even know that they are positive. Mark, how do you respond to that?
Well, Dan, I think this is one of the areas you talked about, some success stories where we certainly could talk about success. You know, when Ian and I started working on HIV 20 years ago, mother-to-child HIV transmission was largely uncontrolled and was causing, in 2001, 2002, upwards of 70,000 HIV infections in infants per annum, and most of those children would not live for very long because of HIV infection developing into AIDS. So we had a childhood AIDS epidemic, and a lot of young children getting sick and dying. Now, because of access to antiretroviral treatments and because of prevention of mother-to-child HIV transmission, we've dramatically altered that. I haven't seen the latest figures. Ian will probably give you the correct figures, but you know, the last I saw, mother-to-child HIV transmission had been cut to less than 2%. It may even be better than that, meaning of pregnant women who have HIV, less than 2% of those women, and there are many pregnant women with HIV, give birth to a child who has HIV. There's a slightly different issue, of course, of children who were born with HIV and who have gone on to antiretroviral treatment and who have lived with HIV. There, the challenges have been, how do we maintain adherence to antiretroviral treatment so that kids don't begin to get sick in their teenage years? And that was a problem before COVID, and I would imagine that it has probably become a greater problem since COVID for the reasons that Professor Ian Sanne has already alluded to.
But is there a risk, Dr. Boffa, let me bring you in, is there a risk that a prolonged COVID-19 pandemic would deepen the inequalities that we've seen, of course, that have long driven the whole campaigns, that have driven the issues around the fight HIV/AIDS, putting the vulnerable children at risk and putting women at risk?
Well, I mean, it's always the case that those who have less access to quality healthcare, those who have less access to information, those who have less access to quality education, right? They're going to be disproportionately affected. So in that sense, yes, there are risks there, and the risk that we also have to maintain the focus on HIV and TB while we're focusing on COVID, right? And that's something that's already been alluded to by other panelists. We have to find ways to not just look at one thing at a time, but consider all possibilities at every interaction.
Yeah, and Prof, I mean, the risk of seeing more children getting infected with HIV and more children losing their fight against AIDS is a real one. I mean, under the current pandemic conditions, or am I reading the situation wrongly?
Yeah, so you know, every one of the gains that we've made in HIV prevention need to be maintained. I think that examples of interventions to try and reduce the incidence. So Mark has spoken to PMTCD, very, very important intervention. No child should be born with HIV, and Switzerland has in fact consistently achieved that. But now we're talking about the group that becomes sexually active, and sexual debut is critically important, education to try and delay that. The second big intervention is circumcision, and the country has had a very active circumcision program with men who are circumcised having a reduction in over 60% of HIV acquisition. So that's really, really important, and it's a once-off event, and protects those boys and young men for life. We've done about 5 million of those in the country. My number may be not perfect, but that's the number I remember. The next intervention is pre-exposure prophylaxis, and there is a drive to providing Truvada as pre-exposure prophylaxis, but more importantly, that's daily tablets, and it has certainly is beneficial. But more importantly is that we're moving into new technologies now with either once-a-month injections or in fact once every 2 months injections, or the studies are underway for one pill once a month that would prevent HIV transmission. The target populations are the high-risk populations, but in South Africa, young women between the ages of 15 and 25 are amongst the highest risk anywhere in the world of acquiring HIV. So we need to really focus down on that generation to try and prevent our young women from acquiring HIV. Sexual debut has a 5-year differential, so the young women start their sexual debut approximately 5 years on average before the young men. And so we target young women and then young men for HIV prevention.
Now, the theme for this year's World AIDS Day is End Inequalities and AIDS. But we know, for instance, in our country today, I think plus minus 8 million people live with HIV, AIDS, and 5 million of them are currently on ART. But we know that the COVID-19 pandemic has exposed and exacerbated poverty and inequalities in our country. So my question is, what are your thoughts about how do we ramp up efforts, and what are these efforts we should ramp up to resolve the inequalities that can drive the HIV pandemic and worsen the situation for us? Mark, what are your thoughts?
Well, I think it's a very serious question, Dan. At the beginning of this epidemic, the whole world realized how COVID-19 was taking advantage of inequalities in access to healthcare services, of gender inequalities, of inequalities between countries. And we made this promise or commitment that we were going to build back better. That was the language. I worry from what I see all around the world, including in South Africa, that we're building back worse, or at best we're building back the same, because we're not deliberately seeking to narrow those inequalities. We have inequality in our health system here between private and public healthcare system, but we are underfunding. In fact, we're cutting health budgets. So we're going to see deepening inequalities in health, which will leave us even more vulnerable to COVID and to any future pandemic. The education system has been terribly, terribly hit by COVID-19, the public education system. The inequalities there have widened. That translates also into the very gender inequalities that Professor Sanne was talking about a minute ago, that leaves young women dramatically overexposed to HIV. So, my hope is that this End Inequalities, End AIDS is not just convenient lip service of the moment, but it translates into real practical programs, because if it doesn't, we will rue the day. I promise you, both with HIV and what happens with the HIV epidemic in future, but also with other aspects of health. So yeah. I'm not a happy person on this front. I think we're not doing by any means enough to address what COVID-19 has taught us.
Okay, Professor Sanne, you also explained some practical things that can be done. As an example, you mentioned the circumcision and the progress being made there. Dr. Boffa, one of the areas you specialize in is the TB area, tuberculosis, and that intersects, of course, as we know, with HIV, AIDS, poverty, and inequality. Your parting thoughts as we conclude.
Well, I mean, just to add what the panelists have already said, I think we really need to pay attention also to making it easier for people to continue to access treatment, being able to access testing during the COVID-19 pandemic, which is thinking outside the box. What are ways that we can prevent people from unnecessarily having to travel in to healthcare centers where they might be exposed? They might expose other people to COVID-19, for example. But what are the ways that we can reach people, help people to access better care, even when this rise in inequality is happening? This is our chance to shine in terms of research and in thinking outside the box and coming up with ways that we can make things really centered.
Thank you very much, Dr. Jody Boffa, Professor Ian Sanne, and Mark Heywood there for that short discussion on World AIDS Day. Of course, the pandemic, COVID-19 pandemic, intersecting quite a lot with the efforts to fight HIV/AIDS pandemic. Over the last 40 years, the world has been, of course, in battle, so to speak, against it, but there's still more that needs to be done. A lot more efforts have to be put into making sure that we do succeed in this battle.